The emergency unit of the Maamobi General Hospital is in dire need of resources to enable it to render optimum care to patients. A visit to the hospital reveals that the unit does not have an electrocardiogram machine, otherwise referred to as ECG machine, and nebulizers for managing respiratory conditions. The only patient monitor at the facility is also not functioning optimally. They said equipment is essential to emergency care.
From the outside, one would least think that a facility of such relevance, which was upgraded to a hospital status since 2011, would be in dire need of such critical equipment. The Maamobi General Hospital is the major facility providing healthcare services to hundreds of thousands of residents in Nima, Maamobi, Newtown, Kutubabi, Pig Farm, among others. Both complicated and uncomplicated malaria, enteric fever, otherwise referred to as typhoid fever, urinary tract infection, and gastrointestinal cases are commonly reported at the hospital.
The sanitary conditions are very poor, and then this translates to the food preparation around by the vendors, and then this is a very important risk factor for contracting it. So these are some of the reasons why these cases seem to be prevailing more in our community.
The facility is also unable to render certain services as required of the hospital.
So currently, we don't have a physician specialist or a family physician, so we are lacking in that regard. When it comes to critical care nurses too, we don't have the full complement. We don't have a surgeon. We do other procedures like CS. Our ONG specialists take care of that. But general surgery, no.
Yet, there are more to the challenges. Its 5-bed emergency unit, partitioned from the outpatient department, is under-resourced. 2 of the beds are allocated to isolated cases. When the unit is overwhelmed with emergency cases, patients are attended to in wheelchairs. This cubicle is the injection room and where patients requiring nebulization are seen. In the absence of the requisite equipment needed for emergency care, the doctors improvise.
Most of our patients that come in tend to be either hypertensive, diabetic, or hypertensive and diabetic. Aside this, most of them that would come with some variants of cardiac conditions. Most often than not, you would require an ECG on the spot to be able to make a diagnosis. Some of these cardiac conditions, making the diagnosis early is very paramount. It helps you with the ability to reduce the morbidity and mortality altogether. And the absence of an ECG or the fact that the patient has to go all the way to the maternity block to have the ECG done can sometimes delay management. So having an ECD on site would be very helpful.
Is that all you may need?
Aside the ECG, I think we may need more nebulizers, more flow meters as well. When the emergency gets really busy, when you have roughly about 4 or 5 emergencies coming in at once, it sometimes becomes difficult as to where to position the patients. Most patients come and they need to be put on a bed. Unfortunately, because of the bed capacity, some patients have to be in critical condition, yet sit whilst you manage them. It's a bit uncomfortable for the patients, very frustrating for patient relatives, and very uncomfortable for the clinician having to examine a patient who is seated. I think with the bed capacity, it is a problem.
Patients are sent to the wards for recovery. There are 22 beds in total, which is also inadequate. Sarah for GBC News, Maamobi General Hospital, Accra.